most amazing thing about this cigarette is? It isn't one. Introducing the NJOY King, the first electronic cigarette with the look, feel, and flavor of the real thing. Finally, smokers have a real alternative. New NJOY King. For cigarettes, you've met your match.
Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. The commercial you just saw in our cold open is the first national television ad for the NJOY King, an electronic cigarette designed to closely mimic the size and feel of a traditional cigarette, making it appealing to smokers looking to kick the deadly habit. It's inconceivable that an ad like this could air today, yet it was only a decade ago, in 2013, when this ad was shown during the Super Bowl in 5 major U.S. markets. In every way, NJOY was a pioneer in the e-cigarette industry, developing innovative products, evangelizing harm reduction, and defending the nascent product category before regulators and the courts. Despite raising tens of millions of dollars and earning a 46% share of the market, NJOY hit the rocks in 2016 and became almost irrelevant. Almost. Today, NJOY is one of the few companies to receive marketing authorization from the US FDA for their e-cigarette products, and as of last week, NJOY is now the only company to receive authorization for a flavor, in this case, menthol. Joining us today for part 1 of a 2-part special is Jeffrey Weiss, former Chief Engagement Officer at NJOY. Jeff, thanks for coming on the show.
Thanks so much for having me.
Jeffrey, I should add that your tenure at NJOY was significant and consequential. You served as a board member, as general counsel, and during the tumultuous years as interim president at NJOY. Is that correct?
That's correct. That's correct. There were basically 2 chapters of the NJOY story. The original NJOY, which, to your point, hit the rocks, went through a bankruptcy process back in 2016. I was interim president through that process. And then the new NJOY emerged in February of 2017. And at that point, I reverted to my prior position as general counsel.
So what was that like to be involved with the company in so many ways?
It was a wonderful experience. When I first began, it really was just as a lawyer advising on things like contracts, patents, intellectual property issues. I'm a patent lawyer by background. And then over time became more involved in the business affairs of the company, got a better understanding of how products are developed, how they're manufactured, how they're imported, how they are distributed, how they're marketed, got a better understanding of the regulatory framework, the legal framework, the tobacco control kind of environment that sort of surrounds all of this. And I think for me, as starting off as a legal professional, I think understanding better the whole picture made me a more effective giver of legal advice. And I think understanding the policy environment gave me a better understanding as to how the company could be successful from a business point of view, staying on kind of the right side of things.
Before we get too far into our conversation, a quick programming note for our viewers. In this episode, we are jumping quickly into some of the issues concerning the FDA's recent marketing authorization for NJOY's menthol-flavored e-cigarette products. This will be a short episode, leaving a deeper dive into the history of NJOY, the legal battles fought in the 2010s, the FDA's deeming rule and its impact, and tobacco control's war on vaping, etc. All that will be coming in part 2 of this interview, releasing shortly after the July 4th holiday. So keep watch for that.
We're following a breaking news alert now. The FDA authorizing the first menthol-flavored e-cigarettes for adult smokers. Blake Eason is at the WKRN.com desk with the details.
Hey, good morning to you, Nikhil. Yeah, so this essentially serves as an indicator that the federal government believes vaping can actually reduce the harms of traditional smoking. So the FDA now says they are authorizing 4 menthol e-cigarettes from NJOY. This decision lends some credibility to vaping companies' controversial arguments that their products can help longtime smokers. Smoking is currently blamed for just under 500,000 deaths every year due to cancer, lung disease, and heart disease. Some parents, though, not happy with the ruling, saying vaping entices young people with their wide availability and variety of flavors. For breaking news around the clock, you can always go to WKRN.com.
Jeffrey, let's start with how important are these recent FDA authorizations for NJOY?
Well, I should be clear that I don't speak currently for the company. My tenure ended in June of last year with the acquisition by Altria. From my point of view, I think they have the potential to be quite significant. I think it's a significant breakthrough that FDA has now authorized a non-tobacco flavor, in particular menthol flavor. I think how significant it ultimately will prove to be will depend on a number of factors. Whether FDA follows this up with additional authorizations, both of other menthol products and of products in non-traditional flavors, for example, food flavors. I think it will also depend on whether this leads over time to any softening in tobacco control's opposition to the products, including candidly to the authorized products. I don't think that tobacco control has really distinguished between authorized and unauthorized products. And so I think this has the potential to be a significant milestone in what has been an incredibly long road. I've been involved in these issues now for more than 15 years, and progress has not been as rapid as I think it could have been. But I think this has the potential to be very significant, but it will depend on a bunch of future events.
Are there any mixed signals being sent here by the regulator?
Well, I think, and I think this comes out nicely in the logic appeal of its menthol denials. I think what we have seen is that back in 2020, 2021, FDA was treating tobacco and menthol flavors interchangeably, treating both as traditional cigarette flavors for which there would be no need to show a differential switching benefit for one versus the other, for menthol, for example, versus tobacco flavor. That changed with the fatal flaw memo. And well, actually, I'm sorry, that changed after Brian King became CTP director, and he initiated a discussion that led to a reversal of an Office of Science recommendation to authorize some menthol products from Phantom. Now, I think I said Logic before, but from Phantom, and to treat menthol as nothing as the same as a candy flavor or food flavor, a non-traditional flavor for which there would be a need to show differential switching benefit. So that was a change in position by FDA. I think it was an unfortunate change, an incredibly unfortunate change, and this decision last week did not actually restore the original handling of menthol versus tobacco. Instead, what FDA found was that NJOY had actually presented evidence that menthol provided superior switching benefit as compared to tobacco. It was great that NJOY was able to make that showing, but in my view, NJOY shouldn't have had to do that. And I think companies with menthol products shouldn't have to show differential switching benefit. Having said that, I think FDA was always clear that for non-traditional flavors, they would expect to see that. So that part wasn't a surprise, but I think that the switching of menthol from a traditional flavor to a non-traditional flavor, I think that was unfortunate, and that seems to be continuing.
So based on those changes that happened at the Office of Science, is the FDA not, is there some consideration besides the science that's been going on, that's been impacting the authorizations for products that have flavor?
I mean, I think there's no question that FDA has been under unrelenting, powerful political pressure throughout the period that certainly that I've been involved. It's not just influential, well-financed tobacco control groups that pressure the agency, that occasionally sue the agency, that are constantly in the media criticizing the agency. We also have powerful folks on the Hill, including Senator Durbin, who I believe is the second most powerful Democrat in the Senate, who relentlessly pressure the FDA. They, literally, he has called the commissioner and asserted his position that all of the flavored products, including menthol, should be denied. He's summoned Brian King to his office, presumably to deliver a very similar message. And so I think that's unique and extraordinary. We don't see it in the pharmaceutical area. We don't see it. We certainly didn't see it during COVID with senators making those kinds of demands of FDA. And so I think that clearly has had an effect. I think the fatal flaw memo, of which there's been a lot of conversation over the years, that followed a pretty harsh June 21st or June 23rd, 2021 hearing in which Janet Woodcock, who at the time was the acting commissioner, was presented with demands by multiple representatives that she deny all flavors, including menthol. And that caused her to initiate the process that led to the fatal flaw memo, which led to kind of mass wholesale denials, and which, gave FDA the ability to say that they had resolved 95% of pending applications with MDOs. But that's really not how the process is supposed to work. It really is supposed to be a science-based process that relies on the unique expertise that FDA has, that it's demonstrated in the medicinal area in terms of its ability to review complex applications and make reasoned judgments that the public can have confidence in. And I think, unfortunately, in this space, the system, while intended to work that way, has not really been allowed to work that way. And that's a continuing problem.
Was there, in the authorizations last Friday, was there a new product added? The daily product, or is that something I'm missing there?
Yeah, no, the daily in tobacco flavor. The daily is a disposable. It was authorized in 2022, a month, I believe, after the ACE pods and the ACE device. ACE pods and tobacco flavor were authorized. So back in 2022, both the daily and the ACE product lines in tobacco were authorized. And then this past Friday, FDA authorized menthol variants of both daily and ACE products. So it's still two product types.
So now NJOY will be the first company to have a flavored e-cigarette that could be legally sold on the U.S. market.
Yeah, I think that's potentially significant. Although I think that certainly was always my view when I was at the company, that the market is not going to work if just one company is out there selling authorized products. We really do need a functioning marketplace with sufficient choice to satisfy the consumers of these products. And given that we now have a very flourishing marketplace of products that not only don't have authorizations, but aren't even going through the process of getting authorizations, I think that we will not be able to displace that market unless and until we have a sufficiently functioning regulated marketplace with authorized products. And certainly, I think Mitch Selig was quite clear both in August of 2020 and again in February of 2021 that it was an FDA priority to transform the marketplace as quickly as possible to a regulated one. And I think that determination to move rapidly, to begin with the larger applications for the larger companies that are selling products that are nationally distributed, his intent to put those first was unraveled by this tobacco control pressure, this congressional hearing, which caused Janet Woodcock to apparently feel that she needed to generate a lot of denials in a very short period of time. And that caused them to completely change focus, which I think was unfortunate. I mean, these NJOY applications that were just approved, they were pending, I believe, for about 4 years. That's not the kind of speed that this is supposed to operate at. The statute itself contemplates a 6-month review period. So, I think the statute can work. I think it can be effective. I think it can deliver a functioning product with the right amount of choice or with a sufficient amount of choice, but not when it's working this way.
So we've heard a lot about these 23 products that FDA has authorized, but if you're a vapor, you don't really see yourself represented probably in those products. What do you think of the list that FDA has produced so far?
Well, I think a couple things. I think if you're looking strictly at e-cigarettes, they've included, I think, some heated tobacco products made by Logic. So if you just look at true e-cigarettes, there's really now 6, 2 Logic products, 2 NJOY products, and 2 Vuse products, Vuse Vibe and Vuse Solo. And in the case of everything other than the ACE and the daily, it's just in tobacco flavors. And I think some of those products, for example, I think the Vuse Solo may not even be nationally distributed any longer. So clearly that is not a functioning marketplace. I think equally problematic, or maybe, I don't know if equally, maybe even more problematic is, I think the contemplation historically was always that if we're going to implement tobacco harm reduction effectively, we need several things. We need FDA review, and it needs to be a science-based review. Matt Myers used to use this phrase, which I really think is a good phrasing, that FDA needs to be the trusted arbiter. And of course, demanding that the trusted arbiter make decisions that you want them to make is not treating them as a trusted arbiter. But I think in addition, it was always critical that adults who smoke need to have accurate information about the continuum of harm, about the risk profile of a potential alternative to smoking as compared to continuing to use cigarettes. And that there really is almost a conspiracy of either silence or at the best silence, at the worst disinformation that is, I think, that we've seen has been terribly confusing to the people who stand to most benefit from these products. They have no idea that these are orders of magnitude safer than continuing to smoke. And in fact, they have the opposite understanding, even with respect to regulated products, or authorized products. So I think that's something that really needs to change if truly this system is going to function the way that it was contemplated when the Tobacco Control Act was passed in 2009.
So when FDA on Friday released the news of these authorizations, were you surprised?
That's a good question. I yes and no. I was surprised just because, we've been so conditioned to see these menthol denials, and it really was looking like FDA had a de facto ban in place, and that we would not see a menthol authorization. So in that sense, I was surprised. I was not surprised that the NJOY application was able to surmount the legal test that was placed before it, even the heightened standard of showing differential switching benefit. David Graham, who ran the regulatory program, is without peer in terms of his understanding of the statute, of the regulation, of what goes into a PMTA. And I was always confident that what he and his team had put together was going to be sufficient to meet the standard. It was just a question of, is FDA willing to stand up to the kind of criticism that it will get when it does it? And of course, we saw literally the day that it issued on June 21st, we saw, incredibly harsh criticism by tobacco-free kids, by the Cancer Society, by the Lung Association, by PAVE, and really, really harsh, nasty, almost anti-vaxxer type language in terms of its disparagement of FDA and its professionals. And I think it's completely inappropriate but not surprising. And, certainly. And so I struggled to imagine that FDA would stand up to all of that. And I'm pleased that they did.
Are they, is my question. In your opinion, are they actually standing up to it?
Well, I guess that is why I think we need to see more of the story unfold before we can really conclude that this is a breakthrough development. I think we need to see if this is the start of a new pattern of FDA following the science, speaking truth to power, being comfortable defending its decisions, and tuning out the noise from the outside, or if this is a one-off and we don't see more. And if we don't see more, I think that's going to be incredibly unfortunate for NJOY and for the marketplace, and most of all for the people whose lives could be saved by these products.
I think it's amazing that calling on FDA to speak truth to power, to stand up to power, that power being special interest groups in the tobacco control quasi-public health space. That's astonishing.
It is astonishing. I think tobacco control has done a remarkable political job of branding themselves as actually being public health. I've seen representatives of tobacco-free kids over the years and others in tobacco control, at conferences say, I speak for public health. And in my view, they are part of an advocacy group, a tobacco control group that represents a particular thread of tobacco control thinking. It's not the only way that tobacco control thinks about these issues. Certainly tobacco control in the United Kingdom and New Zealand thinks about these issues quite differently from US tobacco control groups. But they have created this impression, which, FDA seems to take seriously at times, that they actually are the voice of public health. And I think that's unfortunate. In my view, the voice of public health should be the institutions that have been set up by law to protect the public health, namely and primarily FDA and the CDC, not advocacy groups and not industry for that matter.
It's just strange for the FDA to have done this. You mentioned the de facto ban. That's something that people in the industry, that's something that even the courts, some courts have ruled on, saying that there is a de facto ban. The Reagan-Udall Foundation essentially said the exact same thing. And so then, for FDA to come out and do this, it's interesting. Like for me writing this piece, I can't say what I've been saying for several years now, and that's the FDA has not authorized any flavors because technically now they have.
I actually don't see an inconsistency between FDA's determination to one day move forward with a menthol ban for combustibles and this decision to authorize these menthol products. I actually think it's quite the opposite. I think if you look, what FDA has proposed with its menthol ban is what's called a product standard under the Tobacco Control Act. And just like a PMTA to be authorized has to satisfy the APPH, the appropriate for the protection of public health standard, a product standard promulgated by FDA, if challenged in court, will also have to satisfy the APPH standard. And when that challenge is going to be made, and it will be made if a rule is finalized, the focus will be on what FDA has put forward as its scientific basis for promulgating that standard. And there are two figures that you almost always see when people talk about the potential benefits of a menthol cigarette standard. 650,000 lives saved, 11.3 million deaths averted, and 11.3 million life years saved. But those numbers come out of a population model study analysis put together by a group of folks, including David Levy and Rafael Meza. And in modeling that scenario and in getting to those numbers, they have to address, well, what's going to happen to these current menthol smokers the day after a ban goes into effect? And they predict that 17 to 23% of them will switch to an e-cigarette, and primarily to a menthol e-cigarette. So if you don't have any authorized menthol e-cigarettes on the marketplace, the model falls apart. And so in my view, FDA has something approaching a 0% chance of sustaining against the legal challenge a menthol cigarette ban, unless it first puts in place authorized menthol e-cigarettes that would, in essence, enable that model to be realized. So I don't see it as inconsistent at all. I think in a political sense, it's inconsistent. Like, wait, I thought FDA hates menthol and now they're authorizing menthol. What's the deal with that? But I think if you get below that surface, I think it's actually entirely consistent. And I think it's a necessary step if there ever is going to be an attempt made to finalize a menthol cigarette ban.
It's the off-ramp.
It's the off-ramp. That's exactly right.